I'm Dr. Sebastian Ciancio, Distinguished Service Professor and Chair of the Department of Periodontics and Endodontics at the University at Buffalo and the State University of New York. I've also been a practitioner, an educator, and a researcher for the past 40 years, and have spent a lot of time in terms of developing oral care methods for our patients. As we all know, we all teach our patients how to brush and how to interdental clean or use floss, but we don't all spend a lot of time in terms of having them use effective antiseptic rinses. Now, today I'd like to discuss with you the principles of biofilm formation and why an effective antiseptic rinse, such as an essential oil rinse, is of value as an adjunct to our patient's oral hygiene regimen. Now, what is plaque biofilm and what does it do? Well, first of all, plaque biofilm forms on the surfaces of teeth, and it's a group of microorganisms. They're all working together, interacting with each other, sending messages back and forth to each other. Now, biofilm, as we know, it thrives on the surfaces of these teeth, and it attaches to those surfaces. Now, brushing and flossing as mechanical methods help remove these attached bacteria. The essential oils come in and attack the rest of those bacteria that are on the surfaces of these teeth. Now, let's take a look at what happens once we clean a tooth surface. If we clean a tooth surface, as we do in our office as part of a prophylaxis, within 2 hours, a pellicle lays down on top of the tooth surface. Bacteria then begin to attach to that pellicle, as you see in the 4-hour picture. And then we have a large number of bacteria all clumping together, and it's shown here. And now they're not only coxal-type bacteria, but also some rods are starting to form in this biofilm. Finally, at 24 hours, the biofilm is intact, it's complete, it's producing its products that are producing inflammation in the gingival tissue, and our patient's on their way to developing gingivitis. Now let's take a little closer look at this biofilm, and we have to ask the question, what happens to bacteria in a biofilm when they are exposed to an essential oil mouth rinse? Well, in this picture I'm showing you, wherever you see green, those are live bacteria, and wherever you see red, those are dead bacteria. Now, on the control side, the negative control, you see there are a lot of green bacteria and very few red. And as you would expect, the control is doing very little. Now, in this same 48-hour biofilm model, here we're exposing the microorganisms not to the negative control, but in the picture with all the red, we've exposed them to 30 seconds exposure to an essential oil mouth rinse. And as you can see from that picture, not only are we killing the bacteria on the surface of this biofilm, but we've actually penetrated to the base of the biofilm. And that's helping to kill all the bacteria in that biofilm, or at least 99% of those bacteria. Now, when we think about the mouth, we know that this essential oils help to kill 99% of the bacteria that cause plaque, which helps keep gums healthy. Now, where is this bacterial plaque located? Well, the surfaces we find it on are the 25% of the surfaces are those on teeth, and 75% of it is on surfaces which are on oral mucosa. So they're on the tongue, on the buccal mucosa, the floor of the mouth, the palate, etc. Now, the nice thing about using a rinse is that it reaches all these surfaces. In contrast, mechanical methods reach the tooth surfaces, whereas the rinse actually reaches tooth surfaces both slightly below the gum line as well as between the teeth. And in addition, it reaches all the other surfaces that we're talking about. Now, what is the spectrum of activity of these agents? Well, when they've looked at in vitro, what has been found from in vitro studies is that they are highly effective against some of these agents, these bacteria we're showing here. And as you can see, we're comparing the essential oils to chlorhexidine 0.12% and also to acetylpyridinium chloride 0.07%, since these represent two other categories of widely sold mouth rinses. So what we can say here is that the essential oil mouth rinses have demonstrated activity against a broader spectrum of microbes in vitro than chlorhexidine or CPC, as this slide shows. Now you might say, well, how long have these essential oils been around? Well, they were first invented, actually, and introduced into the surgical market as an antiseptic back in 1879. They then began to be looked at for other uses, including oral care, and that was about in the late 1900s, 1920s, 1930s. Then people said, well, patients who use these mouth rinses have very clean mouths. So maybe we should do some clinical studies to see what really is going on. So in the 1970s, 1980s, good clinical studies were designed to see how effective are these products in terms of reducing the plaque biofilm and reducing gingivitis. And what happened was this. The studies came to a head in 1987 when the data was submitted to the American Dental Association requesting approval, the seal of acceptance of the American Dental Association for the essential oil mouth rinses. And that approval was granted in 1987 based on scientific evidence. Now, that's not where the research stopped, though. The research continued. And why did it continue? Because now they wanted to validate the mechanism that they had shown back in 1987. So a number of studies have taken place since 1987, as you can see, spread over across a number of years, validating the fact that, yes, indeed, essential oil mouth rinses are effective adjuncts to oral hygiene. And then the last question that was answered in other studies done more recently, as shown on our graph here, it showed that it was comparable or superior to other mouth rinse products that are on the market today. Now, in addition to the studies that I'm talking about that were done over all these years, very recently in the Journal of the American Dental Association, there was a paper which was published, and it was a landmark analysis of essential oil mouth rinses. And this evidence was drawn from a very large population and included both published and unpublished data. Let me show you what this study found. First of all, they had 29 studies that were analyzed, and these 29 studies were all of 6 months duration. And the important thing about the 6 months duration is that in order to determine if a product is effective in a clinical study, in a clinical setting, you need at least a 6-month study to establish that effect. Now, they involved over 5,000 patients, and they were done in 3 countries, Canada, Brazil, and the U.S. They involved 4 decades of data collection that had been collected, and they looked at over 500,000 sites. Truly a significant accomplishment in itself. Well, what did the study show? Well, if you look at this graph I'm showing you, you see the little lines, the little graphs show if you use mechanical methods only, you reduce a certain percentage of plaque biofilm. And if you look at the ends of these graphs that are shown here, these are the posterior parts of the mouth, you see that there the patients don't reduce as much plaque, as we all know. They don't do as well on the posteriors as on the anteriors. Well, we call those the hard-to-reach areas. Now, let's say what happens if we then add to this same regimen of brushing, flossing, or interdental cleaning, we add to that same regimen an essential oil mouth rinse, and lo and behold, what we see is that we have a 5 times reduction in black biofilm, and we have 5 times healthy sites compared to the mechanical methods. In addition, they also found that they had twice as many healthy gingival sites compared to mechanical methods. Now, in addition to the efficacy of a product, it's also important that as clinicians we know that the product we're recommending is safe for our patients. So how do we know it's safe? Well, literature tells us that. We know from the studies that have been published that use of these products does not promote oral dryness. They shows no evidence of increased risk of oral cancer with mouth rinses containing alcohol. They do not disrupt the normal balance of oral flora. And lastly, this is most important, they do not cause the emergence of resistant strains, even with long-term usage. And as we know, there is concern about resistance with antibiotics, but with antiseptic agents such as essential oils, that concern is not present. I'm pleased that you could join me in today's presentation, and that I hope that the message you've received is that in addition to brushing and flossing or interdental cleaning, it's also important for us to teach our patients about using an essential oil mouth rinse as part of their daily oral care regimen. By doing this, we can help our patients to have a mouth that is relatively low in plaque biofilm scores, and therefore providing for better oral health for our patients. Thank you very much for joining me, and I look forward to better dental care for all our patients today.